ओंटारियो गवर्नमेंट ਵੱਲੋਂ ਸੋਮਵਾਰ ਨੂੰ ਆਪਣੇ ਨਵੇਂ ਪ੍ਰੋਜੈਕਸ਼ਨਸ ਜਾਰੀ ਕੀਤੇ ਜਾਣਗੇ ਜਿਦੇ ਵਿੱਚ ਕੋਰੋਨਾ ਵਾਇਰਸ ਦੇ ਤਾਜ਼ਾ ਹਾਲਾਤ ਤੇ ਭਵਿੱਖ ਦੀ ਗੱਲ ਕੀਤੀ ਜਾਣੀ ਹੈ ਪਰ ਕੇਸਾਂ ਦੀ ਵਧ ਰਹੀ ਗਿਣਤੀ ਬਾਰੇ ਵਿਸਥਾਰ ਜਾਣਕਾਰੀ ਪ੍ਰੀਮੀਅਰ ਡਾਕਫੋਰਡ ਨੇ ਫੋਨ ਲਾਈਨ ਦੇ ਉੱਤੇ ਸਾਡੀ ਸਹਿਯੋਗੀ ਜਸਲੀਨ ਕੌਰ ਨੂੰ ਦਿੱਤੀ ਹੈ।
Looking at Ontario's COVID-19 numbers, the cases are increasing every day. Models are predicting that Ontario's curve will peak this week. Every day, number of deaths are setting a new record. Where are we lacking in flattening the curve?
Well, right now, I had the opportunity last night, Jasleen, to sit down and get some modeling off our COVID-19 team, and I've always said once I see it, I'll publish it. So I'll ask the doctors today if they can show the modeling, if not this weekend, on Monday morning. What we're seeing right now, Jasleen, across the province is because everyone has been listening and they've been practicing social distancing and self-isolation, the public spread, we seem to be doing better. Where the big problem is, we're putting all the resources in our long-term care homes. Right now, that's where the big issue is, and we're putting in some of the top medical minds, disease control professionals into the long-term care homes. Right now, Jasleen, out of the 626 long-term care homes, there's approximately, as of yesterday, 114 homes have been infected. That's about 18%, and in my opinion, that's 18% too many. And so we're really looking at the hot spots, and I just want to give a special thanks to the hardworking men and women on the front lines of our healthcare, especially in the long-term care homes.
Absolutely, healthcare workers are doing a great job. But as per the data, 41% of all the COVID-19 deaths in the province have been long-term care residents. Registered Nurses Association of Ontario urged the province to restrict healthcare workers from working in more than one long-term care or retirement home, which they often do. And to mandate this, Ontario government introduced action plan for long-term care on Wednesday. But this will not come into effect until April 22nd, meaning there remain plenty of opportunities for COVID-19 to continue to spread between facilities until then.
Yeah, so what we're doing, we're taking an action plan on aggressive testing and screening and surveillance of all staff coming in and out, along with all the patients, especially in the hot spots, as we're saying. And we had to give, when we consulted with long-term care homes across the province, they needed at least 1 week to make sure they adjust the schedules for the nurses that are in there and the healthcare workers that are in there helping out. We couldn't make the change. They didn't want us to make the change overnight. They were concerned about having enough healthcare workers. So that will allow them to make sure they have the appropriate staff. And moving forward in the next, as of the other day, we're testing every single person coming in or going out of the long-term care homes, because that's where the spread is happening with the long-term care health workers, and they don't know they have it until they get tested. And they're putting, I just want to thank them, they're putting their lives on the line every day, and the stress on themselves and their family. And we're just so grateful that we have great people like that taking care of the most vulnerable people in society.
Premier Ford, you mentioned that Ontario has a capacity of about 15,000 tests per day. Ontario completed 9,000 tests yesterday. That was a target set by Health Minister last week. But why do you think our testing is slow and even results are taking time?
Well, right now, the command table promised me that they do, starting yesterday, 8,000 a day. They did 9,000. They're going to ramp it up to 14,000 a day before the end of the month. I believe it's April 25th. We're going to be looking at 14,000 a day. We've increased assessment centers, testing centers. We have enough supplies on the swabs and the reagent to get the test done. So we're putting full focus, 100% resources around the long-term care homes right now.
The union representing the largest number of Ontario paramedics is raising alarm about the supply of personal protective equipment, saying some services could face shortages in the coming weeks. Does Ontario have enough supply of personal protective equipment?
Last week, I was very, very concerned, and I told the public that. Since then, we've seen a tremendous amount of supplies coming in, and even last weekend, any long-term care home that needs protective personal equipment, then they have to just call us, and we have it there within 24 hours. But what I encourage the homes to do, don't wait till the last minute and call us. Give us a day or two's notice, and we'll have it there within 24 hours of their request. But we've checked with every long-term care home in the province. Everyone's saying that they have enough personal protective equipment, and we said as soon as you have a need, call us and we'll have it dropped off immediately for them.
Last question to you, Premier. One of the newspaper in Toronto did analysis and reported that Ontario vastly underreporting COVID-19 deaths in long-term care homes. There's almost a difference of more than 50%. What's your take on this?
They're saying that we're underestimating reporting on the deaths in long-term care. We're reporting every death now. We get it reported in. It goes through the system. It might take 24, 48 hours, but we're accounting for every single death that we have on hand here. So I'm not too sure where they're saying the 50%. I made sure our health experts are fully transparent, and along with the local health units, report to the province. So once we get the numbers from the local health units, then which we have 34 of them in Ontario, then we report it to the people. But I'm making sure that everything we do to the people, and I've mentioned it to the doctors and our team, I want full transparency when it comes to how many cases there are, how many deaths there are, and we've been doing that moving forward.
Premier Ford, before I let you go, I would like to thank you for taking care of Ontarians. We saw that you are personally going and delivering the personal protective equipment. We know all the level of governments are working hard to Canadians. Thank you, and please take care and stay safe.
Well, Jasleen, I want to thank you for your leadership and getting the message out about self-isolating and social distancing. And we couldn't do it without people like yourself and all the 14.5 million people in Ontario. We have the greatest region in the world to work and live in, and I've never been more proud of the people of Ontario than I am right now. So thank you, thank you, thank you.